Electroconvulsive therapy, or ECT, is a medical treatment for mental health conditions. It involves passing a small electric current through the brain, which causes a brief controlled seizure. ECT is a safe and effective treatment option for many people, providing significant relief from severe symptoms. It is often used when other treatments have not been successful and can also be used in emergency situations. ECT is administered by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and nurses. It has been used for decades and has undergone many advancements to ensure its safety and effectiveness. Despite its benefits, ECT is often misunderstood. This essay aims to provide clear and accurate information about ECT.
ECT is primarily used to treat severe mental illnesses. It's considered when other treatment options like medication and therapy haven't worked. One of the most common uses of ECT is for major depressive disorder, or MDD. MDD is characterized by persistent sadness, loss of interest, and feelings of hopelessness. ECT can be life-saving for individuals with severe depression who are suicidal. Another condition where ECT is effective is bipolar disorder. Bipolar disorder involves extreme shifts in mood, energy, and activity levels. ECT can help manage both manic and depressive episodes. Schizophrenia is a complex mental illness that affects thinking, perception, and behavior. ECT can be used to treat schizophrenia, especially when symptoms are resistant to medication. Catatonia is a state of immobility or unresponsiveness that can occur in various mental illnesses. ECT is often the treatment of choice for catatonia, as it can rapidly improve symptoms.
While generally safe, ECT is not suitable for everyone. Certain medical conditions may increase the risks associated with the procedure. Individuals with recent heart attacks or strokes might face higher risks. Patients with brain tumors or aneurysms require careful evaluation. Pregnant women are typically not candidates for ECT, as the potential risks to the fetus need to be considered. ECT requires the patient's consent. However, in some cases, patients may not be able to give informed consent due to their mental state. In such situations, legal and ethical considerations come into play. The decision to administer ECT is made collaboratively by the medical team, the patient, if possible, and their family.
Section 4. How does ECT work? The exact mechanism of how ECT works remains not fully understood. However, research suggests that the controlled seizure induced by ECT affects brain chemistry. Neurotransmitters, the chemical messengers in the brain, play a crucial role in regulating mood, thinking, and behavior. ECT is believed to influence the levels of these neurotransmitters, such as serotonin, dopamine, and norepinephrine. The electrical stimulation might also promote the growth of new brain cells, or neurogenesis, and connections between them, known as synapses. This process could contribute to the therapeutic effects of ECT. Furthermore, ECT may reduce inflammation in the brain, which is implicated in several mental illnesses.
Section 5, the ECT procedure. ECT is an inpatient or outpatient procedure depending on the patient's condition. Before ECT, a thorough medical evaluation is conducted to assess the patient's suitability. On the day of the treatment, the patient is given general anesthesia and a muscle relaxant. This ensures they are asleep and don't experience physical discomfort during the procedure. Electrodes are placed on the patient's scalp. A small, carefully controlled electric current is passed through the electrodes. This current induces a brief seizure, typically lasting less than a minute. The patient's brain activity is monitored throughout the procedure. After the seizure, the patient wakes up gradually. They are monitored for any side effects and are usually able to go home the same day.
Section 6. Side effects and risks. Like any medical procedure, ECT has potential side effects. Most side effects are temporary and resolve shortly after treatment. Common short-term side effects include confusion, disorientation, and memory problems. Headache, muscle aches, and nausea can also occur. Long-term side effects are rare. One potential long-term effect is persistent or severe memory loss. However, this is uncommon and often improves over time. It's crucial to discuss any concerns about side effects with the medical team. ECT is a safe and effective treatment option for many individuals with severe mental illnesses. It offers hope and a chance for recovery when other treatments have failed.